Well, hello and good morning. This is Dr. Yonette. How are you doing, moms and dads? How are you, baby? Baby AJ, Dominic, Kayla, Jane, Mary. I am so happy to talk with you this morning. I know, though, that for some of you, both parents and baby, you are having a very difficult time. And I want to say 1 in 4 of you, to be exact, are having a difficult time because baby seems to be crying a lot. So let's discuss the topic of colic. Today's reference is Johns Hopkins Medicine. So what is colic? Colic is when your baby, although healthy, cries for no apparent reason and for a long time. Now, babies in the first 6 weeks of life may expect or experience this and continue to experience it up until the age of 3 to 6 months. Now, what should I look for to determine if my baby has colic? My baby has been crying and I'm not sure if it's colic or there's something else that's happening or that's going on. So when baby Kayla cries for more than 3 hours a day, you're looking for when baby Kayla cries for more than 3 days a week and more than 3 weeks. So it's 3, 3, 3. 3 hours, 3 days, 3 weeks. Now, what are some of the symptoms that you need to be cued into, journaling about to determine what is going on with my baby, why he or she is crying so much? Here are some of the symptoms. Burping often or passing a lot of gas. And this is because, not because the baby is gassy, because the baby or produces gas, I should say, but it's because of the constant crying, and so a lot of air or gas is getting into the baby's stomach. Now, your baby may also have a very bright, flushed, red face, and that is determined by, and that depends on the color of your baby or the shade of your baby. Now, having a tight belly. When you touch the belly, you feel it so tight and firm. And also look for whether your baby is curling up his or her legs towards their belly when they're crying, and they're also clenching their fist when they're crying. Okay? So with colicky babies or with colic, you should expect that your baby will be fine one moment and then suddenly begin crying, and he or she is crying non-stop and so loudly you can bring out the neighborhood to your home. So no parent wants to hear that their baby is crying, and this is a very, very difficult thing to deal with. Your baby is crying, you want to help, and so it becomes very stressful and very difficult to tolerate when you can't do anything to help. So this is what you should expect if you have a baby, a colicky baby. He or she will be fussy very often. He or she will be fussy. He or she will be gassy. He or she would not sleep well. And then in most cases, he or she will gain weight and grow as a normal baby. So you want to bear in mind that colic will go away on its own. I know for a lot of people in the Caribbean and in other countries, we have our own little treatment that we use for colic, and I don't know how effective it is, if it's a part of your mind, your belief, or if it's really helping your child. But we have a whole lot of little side regimens that we use with our baby. I'm not going to get into that because I don't know that it's scientifically proven to be effective. But Bear in mind that colic will go away on its own, and this will happen by the age of 3 months, and in most cases by the age of 6 months. Now, we've been talking about colic, but how or what causes colic? How is colic caused, or what causes it? The researchers don't really know for sure what is the cause of colic. There are some theories out there, and this is what they say, that colic may happen or occur in babies who are sensitive and have trouble adjusting to the world. They have been protected in the womb all this time, and now they're coming into this world with all its environmental pollutants and the noises and all the sensory stuff that is happening. And so that your baby might be sensitive and having trouble adjusting to this new world. So he or she might end up having colic. Another explanation is that your baby is having difficulties calming themselves, his or herself. And so, it may result in the baby crying a lot and crying for extended periods and crying loudly. There's a couple of other theories that say that your baby is sensitive to gas, but we had that discussion already. It's not that your baby is producing more gas, but it's just that more gas is coming into the body. So that theory is kind of very shaky. Now, another theory is that your baby may have allergies to milk or intolerance to milk. Okay? So, which children are at risk for colic? Is your child at risk for colic? Is your baby at risk for colic? All families actually are at risk for having a baby with colic. Any baby can become colicky. So, what do you do if you find that your baby is colicky? He's crying uncontrollably, so loudly, for long periods of time. What do you do? There are many tips, many things that you can do to help soothe and deal with your baby. Know that this is a common problem. Remember, we said 1 in 4 babies would have colic. So talk with your child's doctor, your pediatrician, to find out if you are experiencing this in your child, in your baby. Talk with your pediatrician. If your baby is being bottle fed, it may help if you use a curved bottle, okay? Because this is going to let you hold your baby in a position that is upright, and it will reduce the amount of air that the baby swallows during feeding. And then you want to also burp your baby often. And this is one thing that we did a lot when we were growing up, As soon as you finish feeding baby, put him up on your shoulder and burp him. Rub his back or tap his back until he burps. So burp your baby often. And then also use a bottle that has a collapsible bag inside. This is going to help as well. So you want to do those 3 things. When you feed your baby, use a curved bottle. When you also, the bag inside of your bottle should be a collapsible bag. And when you're finished feeding baby, and as often as possible, you want to put baby up on your shoulder and burp him. Now, remember, we are continuing to journal so that we are seeing exactly what is happening with your baby and what is working for your baby. So you need to understand your baby's cry and how to deal with the colic experience that he or she is having. What works for one baby may not work for another baby. So make sure you are really cueing in, journaling again, and cueing into what your baby needs. Make sure when your baby is crying and screaming uncontrollably for a long period of time, check to make sure that your baby isn't hungry. But remember this, don't force feed your baby if he or she is not interested in feeding. Okay? Check and see if he's hungry. If he's hungry, feed him. If he's not hungry, don't force feed him. Now, the second thing I want you to bear in mind is to change your baby's position. Sit your baby up if he is lying down. Let your baby face forward when you're carrying him or holding him. And then also provide various views for your baby to observe. So change your baby's position. Give your baby interesting things to look at. You know, we talked about this before. Different colors, different shapes. Make his world exciting. Different textures and sizes. Make his world exciting. And then talk to baby. Talk as you are talking and you're interacting. Talk with your baby or talk to your baby. Sing to your baby. We've been saying this over and over. Sing to your baby and read to your baby. Okay, so a couple more things that you can do. Rock your baby. Rock as you sing. You can walk. I see lots of parents going for their morning walk. Go for your walks with your baby and give your baby a warm bath. Your baby becomes very colicky. Give him or her a warm bath. Now you also want to place the baby in an infant swing, so on a slow setting. All right? Baby's already agitated and upset and crying. You don't want to add more energy to the mix. You want it to be slow and calming so that he helps to organize himself. Okay, so you put it on the slow swing. Let your baby lie on his or her belly or on your lap and rub his back softly. So that's another thing you can do when your baby starts crying and become colicky. Put him on his belly, put him on your lap, and rub his back softly. You also want to go for a ride in the car because the motion, the movement often soothes baby and would help him to fall asleep. Try using something in your child's room that makes a sound, such as a fan. You know, we talk about white noises. Use a fan or turn on the washing machine or the vacuum. These are white noises that can be calming for your fussy baby. You also want to cuddle and hold your baby. In the past, we used to say that cuddling was to your baby too much will spoil your baby. But remember when I started talking about colic, I mentioned that perhaps one of the reasons why your child has colic is because he or she is unable to calm himself. And you holding and cuddling and providing that nice, tight, supportive environment that mimics the womb will be a great experience for your baby. You want to also try to use a pacifier. If the child takes the pacifier, use it so that the child also has the opportunity to calm himself. Sucking is very common. You know, the baby sucking on a pacifier calms him or herself down, helps with the calming. Even for older children, when you're taking an exam and you're sucking on a lollipop, that is calming and organizing. So use a pacifier if you have to, and keep any stimulation that you're giving to baby at a minimum. You know, try to minimize all the stimulation in his environment. All right, so now you determined you've been going through this for the past week or two, and your baby is just crying and crying and crying. Now, what should you do in terms of your healthcare provider? When should you say, "Oh, I've had enough. This is not working. This is not getting better. I think something is wrong"? When should you call your healthcare provider? Before assuming that your child has colic, look for other signs, Look for signs to see what is actually going on. And again, we're going back to journaling so that you know exactly what is happening. Look and see if your child is sucking or drinking a bottle well. Look and see if your child is drinking less than usual. If your child is vomiting, if your child has diarrhea. What about looking at more how much more irritable is your child is when you touch him or hold him? Look at how strange the sound of his cry is. And then you also want to observe whether the changes in breastfeeding rate and effort to breathe are taking place. You want to be more look observant. You want to be more observant in regards to the child's sleep pattern and how well the child is sleeping. And also check the temperature. Is the child having a fever? Is there an ear infection? Some other thing that is going on. And then if you find out those bits of information, you want to call your healthcare provider if you see any of the symptoms that I mentioned above. Also, you want to call if your baby is crying too much. Your child's pediatrician will do an exam to find out what is actually going on. And make sure there are no other health problems that are coming up in your baby's life. So here are the key points about colic. Colic is when your baby cries for a long period of time. We said if your baby is crying for 3 hours, 3 days a week, for 3 months. You also, another key point here is that colic affects 1 in 3 babies in the first 3 to 4 months of life. It usually begins suddenly, and you would observe that there's a loud, mostly non-stop crying. No, loud and non-stop crying in baby. You also want to be aware that it is very, very difficult for a colicky baby to calm him or herself down, and they end up feeding differently, and you want to help the baby to calm. Okay, you want to help a colicky baby to calm himself by holding and doing those recommended activities of walking and going for a drive and rocking, those kinds of things to help with calming. And then colic, your greatest takeaway, colic is that it's going to go away on its own, sometimes by month 3, but in most cases by month 6. By month 6. Okay? So today we are talking about colic, and I know that for some of you, you are having that heart-wrenching experience hearing your baby cry and cry and cry and cry uncontrollably. So it was important for me to share with you these tips this morning so that you know what to look for to determine if your baby is experiencing colic, and then how to adjust your life, how to use strategies that will help your baby through this 3-month or 6-month period while he or she has these experiences. This is Dr. Yonette coming to you this morning with another episode of how to raise your baby, parenting, and today we talked about colic. I want to encourage you to take care of your baby while you take care of yourself. Have a fabulous Friday.